I'm Brian Lane. I'm the President and CEO of the Center for Health Affairs, and I'm so glad to see you here this evening. And I want to welcome you. Most of you, I believe, for the first time. And I think a lot of you were kind of caught off guard that you have one of the best outdoor decks here that could be utilized by all of you on a regular basis. So come on down to our offices here in the beautiful Playhouse Square district, partner with us, and let's start using it. It means so much for us here at the center to be part of this vibrant city, to have the opportunity to work alongside the incredible people, organizations, including all of you who share our commitment to better health within Cleveland. As part of our 100+ year history, keep in mind we were founded in 1914. 1914, the Center for Health Affairs has been a convener, a collaborator, bringing together hospitals and partners throughout our community to solve problems. And that's what this evening is all about. Today, we also celebrate the 12th year and anniversary of the Affordable Care Act, ACA, and its benefits. That's a big deal. and the benefits it's provided to our fellow community members and our citizens. There's a great deal of tremendous work happening here within Cleveland to move our community forward and to improve the lives of people who live, learn, work, and serve, I chose that word purposely, here within Cleveland. We invited you here today to hear from Mayor Justin M. Bibb about his administration's healthcare priorities for Cleveland and to learn how the Center for Health Affairs initiatives dovetail with that and how your organizations can partner with us to add up greater value for our community. And I always say 1 + 1 = 6. That's how we add it up. We link ourselves to one another, we partner, and we get it done. Before we hear from Mayor Bibb, I'd like to introduce 2 hospital leaders who also serve on the board of directors here at the Center for Health Affairs, as well as Community Health Affairs. Heidi Gartland of University Hospitals and Susan Fuehrer of the Institute for Hope of Metro Health System. Heidi is the Chief Government and Community Relations Officer for University Hospital and has been involved in our member organization for many years. She's the Chair-Emeritus of the Center. She's the person who literally has been the most responsible one in keeping this place around and keeping it relevant, and I want to give her thanks for that. She's also the person you got to see when you're coming up the elevator with the beautiful picture on the wall. And that's our way of thanking you, and I want you to know that. And love you very much, and very, very appreciative. So I'd like to welcome you up here, say a few words on the membership behalf. Please welcome Heidi.
Okay, well, that was really nice. And I didn't even see my picture on the way up here, so that's embarrassing. Obviously not observant, so sorry about that. But I will just say, first of all, I'm just so excited. This is like the 3rd time I've been up to this space, and we're using it for the purpose it should be, which is inviting the community in. That is what our Center for Health Affairs is all about. And I really want to thank Brian for that nice introduction. And I want to welcome you. You all are community leaders. And without you here and without whatever you do, and I'm so excited that Mayor Bibb is here and he's brought a great team. I hope he will introduce. And I think if you don't know him, you're going to need to know him because he is going to change the face of Cleveland. And I'm really excited about that. So I also want to say that it was a point of personal privilege for me to be chair when we recruited Brian. And you saw that enthusiasm. I was exhausted after our first or second interview with him, and I didn't even talk. I just had to listen. And he is just phenomenal. And I hope you will join him and the center in the efforts that they are putting in front of you to partner with us. It is a great way. We know 1 + 1 = 6. I hope you've trademarked that. If you haven't, you need to. But we've done a lot of really great things in this community. I want to acknowledge also Danielle Price, who chairs their Health Foundation. She works with me at UH, and our community health needs assessments is one outgrowth of this collaboration that we've done here with the Center for Health Affairs. Again, all the hospital systems, the public health department, county health department, And it was the first time we ever did it. And I know you have scars and wounds and whatnot for those of you that were part of that, but now it's a well-oiled machine that looks at what we need in this community, and we need the voice of everyone. We also put together a collaboration for opioid. So we're very timely, right? So we're 100 and so many years old, or however old we are. I'm really bad at math, so I chaired the finance committee here, which is really embarrassing for me to ever say, but I did. So anyway, it was better that I chaired the board than the finance committee. But we also put that collaboration together because it was the need of the community at the moment, and mental health or community issues and social determinants of health. And I'm so glad Susan's going to be right after me because she's doing amazing things at Metro and all of our colleagues. So with that, I could go on, but I just really want to welcome you, want to thank you for being here, and thank Brian and certainly Christine Dodd, who I know probably put this whole thing together. I want to really thank her as well. So I'll shut up and turn it back over to you, Brian.
Thank you, Heidi. We're grateful to you for your service, your leadership to the center and our healthcare community. Now I'd like to introduce another dear friend, Susan Fuehrer. Sue is the president of the Institute for Hope of the Metro Health System. Prior to this position, you probably all know she served as the CEO and the director of the VA Northeast Ohio Healthcare System. She currently serves as the board chair for our newly named Community Health Affairs Board. And we've done that purposely for our mission to serve this community. And Sue is a longtime advocate for improving health within our community. Sue, the platform, the podium is yours. Welcome.
Thank you very much. I think everybody here is a friend of Brian's, right? He has lots of friends for being here for such a short period of time, and what a difference he has made in our community. So, Mayor, congratulations. Thank you for stepping up. We look forward to absolutely fabulous things, and here we are all here to help you. And as the chair for the Community Health Affairs Committee, I am so proud to be able to take on this position because we know that we live in a community that has the very, very best healthcare facilities, probably the best in the world. But we also know we live in a community where we have really sick people and we have poor health outcomes. And we have not done a good job moving upstream to take care of people where they work, live, and play. And that's why it is an honor to serve as the board chair. We have a couple board members here. Dr. Claude Smith from Healthcare Alliance is here, and Freddie Robles is somewhere from Catholic Charities. And what's really nice about this community, there he is that this board is not just hospital leaders. It's not just healthcare leaders. It is members from, like Freddie, community-based organizations, community development organizations, Tim Tramble from St. Luke's for philanthropy. It is bringing all of us together in partnership to collaborate, to move upstream, to address those 80% of factors that happen outside of any hospital wall or outside of any medical clinic. Because our goal is, I was joking with people before, I would love to put Akron out of business, right, as a hospital CEO, so that people didn't need to come to hospitals to get care. He's retiring early, so I don't think I'm going to get it. But, what I am confident on is that the Community Health Affairs Board is going to work really hard, and we are going to serve to tackle these upstream issues, to address how do we get people good paying jobs, a living wage? How can we make sure they have access to healthy food? When they go see their doctor and they have diabetes and the doctor wants to prescribe insulin, and someone says, well, I don't have a refrigerator to keep that insulin, or I don't have a working refrigerator, or I don't have utilities, or the worst of all, I don't have a home, that physician has little chance of success in that 15 minutes left they have in that appointment. And so that's why we are working together, and I'm really proud. I was congratulating Danielle and Heidi because in Northeast Ohio, all the healthcare systems are participating in an electronic health network that's called, a platform network called Unite Us, or here in Ohio, Unite Ohio. And this is allowing referrals to happen. So when someone has social needs, we can now use this electronic platform to participate with more than 170 community-based organizations. And not only can we connect them, we can see when those social service agencies close the loop. And we will be able to say, how does that impact health outcomes, inappropriate utilization of care, total cost of care, and most importantly, quality of life for the patients that get connected with these services. So our mission is for Cleveland to be known as the healthiest community, as well as the community that has the best health care. A community where everyone has the opportunity to live their healthiest life. And we will continue to serve until we make a difference. Thank you.
Thank you, Sue and Heidi, for those remarks and for your many years of support of our organization and our community. With that, I know I speak for all my colleagues, as well as for the Center for Health Affairs and all our guests tonight, when I say that I'm honored for Mayor Bibb and his amazing team to be here with us this evening. Thus, I will now turn it over to our keynote speaker. Please join me in a warm welcome to the Honorable Cleveland Mayor, Justin M. Bibb. Yeah.
Well, I grew up in the Black church, and as my pastor would say, I'm not going to hold you long. But it really is an honor and a joy to be here today. And no mayor is good without a world-class team. And I'm really thankful to be joined here by two of my top leaders in my cabinet, my Chief Administrative Officer, Elise Hara-Abel, and Dr. Karen Cooper, our Medical Director for the City of Cleveland. Elise is leading up our COVID-19 task force and is doing a fantastic job. And Dr. Karen Cooper is also playing a major role in helping us to really transform our health department for the 21st century. And I'm proud to announce that in just 80 plus days, we have increased our vaccination rate by over 3 percentage points. When I took office on January 3rd, our city had a 45% vaccination rate, 45%. Now, and correct me if I'm wrong, Dr. Cooper, we're at 48.7%, is that correct? 48.7%. So we have a citywide goal of 60%. And so I'm gonna be counting on all of you in this room to make sure that by the end of this year, we get to 60% of our residents being vaccinated. So, Brian, hope you're ready for the task. Good, good. You know, one of the things that I've been reflecting on over the last couple of weeks is the importance and the power of relationships. And this body right here played a major role in my success to becoming mayor. When I was a freshman at Trinity High School on their freshman football team, I wanted to be a receiver for the Browns. Obviously, that didn't work out too well. But I met one of my best friends in high school was Tony Carrero, and he had a sister, Marie Carrero, now Maria Summers. And when I announced my campaign and announced my nonprofit last year during the height of the pandemic, Maria connected me to Tracy. And Tracy Wise and the leadership in this room helped us build a community-wide effort during the height of the pandemic to distribute over 75,000 masks to low-income residents in this city. And so I tell you that story because relationships matter now more than ever, especially when you consider the nuance of the issues we're facing in Cleveland right now, particularly when it comes to public health. And our COVID-19 task force has been really working very hard to make sure we get our residents vaccinated and boosted, but also that we do the hard work of really challenging the misinformation that we've seen in this community over the last 2 years throughout this pandemic. You know, when I was knocking on doors and going to barbershops and salons to get votes to become the next mayor of Cleveland, whenever I talked about COVID-19, particularly in communities of color, The biggest question I would get is, I don't trust the science. I don't trust hospitals. I'm not taking no vaccine. I'm not getting tested for no COVID. That's deep. That's structural. And for us to do the hard work to make sure that we address these vexing healthcare disparities in our city, we as leaders in our various institutions, Brian, we must do a better job of building trust. For the first time in nearly 20 plus years, people don't trust our institutions. We live in a society where that social contract is broken. And I believe that local government can play a large role in changing that trust dynamic, not just in Cleveland, but all across the country. And one of the things I believe we can do in order to do that in Cleveland is to do what we said we were going to do. Do what we said we were going to do. And so in just 80 plus days, not only did we build I think an amazing collaboration between our healthcare institutions and our schools and our other key nonprofit partners across the city with our COVID-19 task force, we've also worked with organizations like the Cleveland Clinic and the Lead Safe Coalition and others to raise over $100 million to eradicate the lead paint crisis. Thank you. And as mayor, in partnership with City Council, we have agreed to allocate $17 million from the American Rescue Plan dollars to support that effort. In the coming weeks and days, I'm going to be announcing the first ever lead senior strategist in my administration that will work. Thank you, Heidi. That will work across every single department, from community development to public health to building and housing, to make sure that we eradicate lead paint in our city, because it's a damn shame that our babies continue to be disadvantaged due to the lead paint crisis in this city. And throughout the campaign last year, I was at a protest about this issue. And Yvanka Hall, if you guys don't know Yvanka Hall, I'm sure you'll know about her at some point soon. She leads the Northeast Ohio Minority Health Coalition. And at this protest, she invited all the candidates to come to this protest. And only a handful of us showed up. But she said something very important. She said that the lead paint crisis in Cleveland is public enemy number one. She was spot on. Everything starts at the home. And if you are raising a child that is being infected with lead paint and their brain is not developing appropriately, then you see the long-term consequences. So we must use every asset we have in this city and this community to eradicate the lead paint crisis. The other thing I think it's important to think about is, how are we building a city where everyone can thrive and live up to their God-given potential? As Heidi mentioned, we have some of the best healthcare institutions in the world, from UH to Metro to the Cleveland Clinic. However, one of the biggest things we failed to do in the city is really invest in the built environment for people. And this is one of the hardest parts of my job, because just yesterday, I was having a conversation with a major employer in town, a major healthcare institution, that's gonna spend over $1 billion of new investment to expand their hospital. And as I'm thinking about my ability to approve that project, I couldn't help but think about that poor family who may not get the benefit of this project. How do we change that dynamic? How do we make sure that these projects are built with the people in mind first versus the other way around, right? That's how we change these systems long-term in a systemic fashion. So one thing we're doing across city government right now is we want to be one of the first cities in North America to adopt a 15-minute city planning framework for our city, so that every city dollar we invest in terms of development focuses on making sure that from Mount Pleasant to West Park to Camps Corner to Buckeye, there's a healthy grocery store for folks to walk to within 15 minutes. There's affordable high quality public transit within 15 minutes. There's a good quality park that's well programmed and well lit within 15 minutes. That's how we eradicate these healthcare disparities in our city for once. You know, in this job, it's easy to think that you can't make change, given the fact that there is just a sense that government does not work anymore in this country. And you only have to look at the news for a little bit to kind of lose hope. Even in watching these Supreme Court hearings, it's hard. It's very hard. But one of the reasons why I ran to be mayor is because I believe that American cities are the front lines of restoring democracy in this country. We will be the laboratories of innovation to get the lead paint crisis right, to fix affordable housing, to fix police reform in this nation. And as you think about where the nation is going in our post-pandemic world, I truly believe that Cleveland can lead the next chapter of America's recovery to be a leading mid-sized city in America. But for us to do that, we must do a better job of partnering. We must fully embrace a true spirit of collaboration. And my vision as mayor is to make 601 Lakeside Avenue the front door of collaboration in this city. If we retreat, and if I stay in my ivory tower and think that we have all the answers, nothing will get done. But if we reach out, we ask hard questions, if we challenge our assumptions, and if we remain proximate to the people, then I believe we can be that model for the nation to get it right. In closing, you know, one of the things that I think about often is how to maintain a level of hope and optimism. You know, every day across my desk, there's a family that loses a loved one to violent crime. There's a closed business that can't stay afloat because of the labor market issues. There's a senior citizen who can't afford to stay in their home, so they're getting pushed out and priced out for their neighborhood. But the thing that gives me hope is the can-do spirit and the willingness of Clevelanders to lend a hand, give back, and offer their support. So I want to thank you, Brian, and your leadership team for being a good model of collaboration. Thank you for having a can-do spirit. And I believe if we stick together, if we work hard, and if we challenge our own assumptions, we can be that model for America together. Thank you so much.
I have chills. I have chills. I know that I, for one, am extremely excited and energized by your vision. But most importantly, I love that you're challenging this community. Keep doing it, okay? As I look to Cleveland's area focus for better health within our community, we share so much in common. And I'd like to spend a few minutes sharing with you the important work that we're currently engaged in and what I see as our future opportunities of partnering, where all respective organizations can get involved. There's a data point that I often cite, and it's not one to be proud of, but it's a very important one to point out and address. In 2019, our great city of Cleveland overtook Detroit for the highest poverty rate among the nation's largest cities. That year, more than 114,000 people lived in poverty, including more than 37,000 children and nearly 12,000 older adults. And more than 6,500 of those adults in poverty worked full-time for an entire year, but did not earn enough to propel them above the federal poverty line. Let that soak in for a second. Understanding that particular need is vital. I have most important on my speech here, but it's vital to our ability to do something about it. And this is part of the reason we partnered with the city, county public health leaders, area hospitals, healthcare systems, several other organizations within our community to conduct collaborative community health needs assessment. It's also the reason why I'm here. We completed the first joint assessment in 2018. Shout out again to you, Danielle. Love you very much. You're the driver. And then went on the following year to expand that collaboration to include partners throughout Cuyahoga County. It currently serves as a national model for other states, cities, and hospital associations throughout the U.S. We've got some copies around here. For those of you that have never seen it, grab it. If you want to see it, we'll send it to you via email. It is very important that you understand the data within it. That assessment has formed the basis of so much of the work that hospitals, public health officials, and other partners are doing to address the health needs and improve upon our health and well-being here within Cleveland. What is arguably the most important outcome of that assessment was establishing the goal of eliminating systemic racism in Northeast Ohio. We know that racism is a public health crisis, and there's much work to be done to achieve better health equity. I'm glad we're in alignment. I really do. Just a little sidebar. We see that in health outcomes across the board, and at no time has there been a truer moment than during the pandemic when we saw the disproportionate impact it had on communities of color. We are all familiar with the toll the pandemic has had on our city, our state, our entire country. It's impacted our communities in so many different ways, directly and indirectly. And one of these ways is what we've heard called an epidemic within a pandemic, and it is worsening. And that's of already significant opioid and substance abuse disorders and that crisis within our own community. In Cuyahoga County, overdose deaths increased around 30% from 2020 to 2021. And overdose deaths, or I should say overdoses from cocaine fentanyl mixtures increased to, and get ready for this number, over 85% during that time. This growing need is another core area where we're focusing our efforts through the Northeast Ohio Hospital Opioid Consortium. The consortium, if you didn't know, came into being when the health systems in our community came together along with the center to form a collaborative physician-led response to this crisis. Through the consortium, we are sharing best practices around treatment and prescribing, and our staff at the Center for Health Affairs has been working with the hospitals as well as public health partners to develop robust educational offerings for nurses, frontline staff, and the latest addition for prescribing clinicians. The Opioid Consortium strategic initiatives also include work to access to and awareness of naloxone for reversing overdose and increased use of medication therapy for treating opioid use disorder. We are also focused on polysubstance use, which has become increasingly, and as I said before, understood as the next front line in this battle against substance use disorders. This is where we need your help. These efforts have enabled the consortium to be nationally recognized and working closely with the White House and HHS and other respected health associations focused in on substance abuse issues. A few of those are in this room. And thank you for serving. These efforts that I have described are what we're doing right now to help make our community healthier. But we also know there's so much more to be done. When we look at social determinants of health, we see so much opportunity for making an impact, whether that is through addressing food insecurity or expanding access to transportation, tackling lead poisoning, and improving upon maternal health. Many of you in this room are currently working on some of these core issues. Our vision at the Center for Health Affairs is to continue to build upon this amazing work and to leverage the data and analytics to create a foundational infrastructure on which innovative solutions can and will be developed. And for those of you who know me, you know that we're going to deliver upon that. Some of the areas of focus include health, life science, research, education, workforce solutions, and innovation. We see an opportunity to create a healthier community and to propel Cleveland forward as a leader in addressing these issues. I hope all this resonates with each and every single one of you, and that you're as excited and as passionate and energized as I am. Maybe give it a try. I'm really happy to have all of you here and want to focus in on that work. If you are not currently involved with us or yet partnering, please make the connection. I beg of you. That's what this evening is all about. And that's making the connections, making a difference, and getting involved. I want to thank you for being here this evening and taking the time. And I've enjoyed seeing my dear friends, my family is the way I look at it, the CLE community leaders and colleagues, and laying the groundwork for new relationships and partnerships. I want to express my gratitude to the Center for Health Affairs' incredible team and our partnership with Naylor Association Solutions and their team who are here this evening. Great job tonight. You really outdid yourselves, and I want to give you guys a huge round of applause. Can you help me with that? And let me extend a huge thank you to Mayor Bibb and his team for joining us. This place is yours, okay? This place is yours. We are so grateful for your leadership and for sharing your vision, and super, super duper excited to work with you and your team. We want to make an impact. We are here to serve. I always say 1 + 1 = 6, and you've heard that now twice. Remember that equation, everyone. Partnering leads to compounded impact as well as positive outcomes. We cannot do it alone. We've got to collaborate. Now let's go create some impact together, get some additional food, and add up greater community health value. And with that, I wish you all a great evening. Thank you, thank you, thank you.